Hi everyone, I'm Katharina Kang, Mission Programs Manager at Komen, North Texas. I'm excited to be back with you again for a monthly educational series. If you missed last month's episode about breast cancer screening, be sure to check it out on our Facebook videos or our YouTube page. Just search for Komen, North Texas. This month we're focusing on breast cancer risk. You may have heard that 1 in 8 women will be diagnosed with breast cancer in her lifetime. This is referred to as the lifetime risk of breast cancer. This means that for every 8 women in the U.S. who live to be the age 85, 1 will be diagnosed with breast cancer during her lifetime. This is an average figure. There are certain risk factors that may increase or decrease an individual's risk. Here are just some of the risk factors we know about. Some of them may increase risk while others may decrease risk, but none of these factors can 100% guarantee that a person will or will not develop breast cancer. Age, being female, genetics, lifestyle such as diet and exercise, the environment, dense breasts, breastfeeding, drinking alcohol, and body weight or weight gain. Let's talk a little more in depth about 2 of these risk factors, genetics and dense breasts. When it comes to genetics, most women with breast cancer do not have a family history of the disease. In fact, only about 13% of women diagnosed have a first-degree female relative, like a mother, sister, or a daughter, with breast cancer. But it's still very vital to know your family history, both your mother's and father's side, and not just your family history of breast cancer. A family history of other types of cancer can also indicate an increased risk of breast cancer. This increased risk may be due to genetic factors, shared lifestyle factors, or other family traits. For example, having a first-degree female relative with ovarian cancer increases the risk of breast cancer. Having a first-degree male relative with prostate cancer may also increase the risk of breast cancer. Families with a strong history of breast cancer may carry gene mutations, although inherited gene mutations account for only 5 to 10% of all breast cancers diagnosed in women in the U.S. That's why when someone says, "I don't have a family history of breast cancer," you need to encourage them to still get screened and know their risk, because genetic factors are not the sole cause of breast cancer. In fact, the 2 biggest risk factors for breast cancer are being a woman and getting older. That's why it's so important to talk to your healthcare provider about your family history of breast cancer and other diseases, as well as your personal history, to understand how this impacts your risk of breast cancer. I also mentioned having dense breasts as a breast cancer risk factor. Breast density is a measure used to describe the proportion of the different tissues that make up a woman's breasts, breast tissue and fatty tissue. Breast density is not a measure of how the breasts feel, but rather how the breasts look on a mammogram. Mammograms of dense breasts are harder to read than mammograms of fatty breasts, because breast tissue and breast cancer both appear white in mammograms. Further, women with high breast density are 4 to 5 times more likely to get breast cancer than women with low breast density. For now, we don't know why women with dense breasts have an increase of breast cancer. While there are no specific recommendations or screening guidelines for women with dense breasts, it's important to talk to your doctor to determine a screening plan for you, which may include alternative imaging tests. There are many factors that affect risk, and there's no straightforward formula to determine who will and will not develop breast cancer. One woman may have a strong family history of breast cancer and never develop the disease, while another may take proactive steps to reduce her risk and still find herself facing a breast cancer diagnosis. Clearly, there's a lot to know when it comes to risk. In fact, that's one of Komen's key messages to all women: know your risk. Talk to both sides of your family to learn about your family health history, and talk to your doctor about your personal risk of breast cancer. Empowering yourself with this knowledge can help you make decisions for your future. Find more information about risk factors and others on Komen.org, and be sure to visit KomenNorthTexas.org to register for the Komen North Texas Race for the Cure on June 10th. See you at the race.